So you're struggling with tight hamstrings and you want to figure out, the best ways to deal with it.
Yeah, that's a really common one.
Definitely. So for this deep dive, we've gathered quite a stack of info to help you out. We've got articles from places like Medical News Today and Very Well Health covering the basics.
Uh-huh.
Then there's some expert insight from Dr. Chris Norris on the actual mechanics, which is interesting.
Oh, yeah, the biarticular aspect.
Exactly. Plus, a big systematic review looking at injury prevention, some really practical stuff from Peterson Physical Therapy and G&B Fitness.
And the stretching techniques. PNF from Healthline, beginner tips from a Reddit thread, even active isolated stretching from Stretch 22.
Right. Quite a mix. So our mission today, basically, is to pull out the key actionable things, maybe some surprising facts, too, to help you understand and hopefully improve that flexibility without getting totally overwhelmed.
Let's do it. We want to connect the dots so you really get what's going on and how to actually make a difference.
Okay, so starting right at the beginning,
Mm-hmm.
when we talk about hamstrings, what exactly are we talking about?
Okay, simply put, the hamstrings are those three big muscles on the back of your thigh. They run from your hip, specifically your sitting bone, down to just below the back of your knee.
Got it. Back of the thigh.
And they're crucial, absolutely crucial for everyday stuff, walking, running, jumping, even just standing up properly, things we barely think about.
Right, the real workhorse is back there.
Yeah.
But there's more to it than just location, isn't there? How they actually work.
That's where Dr. Norris's points get really interesting. He highlights their biarticular muscles,
Biarticular meaning?
meaning they cross two joints, both the hip joint and the knee joint.
Ah, okay. And why does that matter?
Well, it's super efficient. It lets your body link movements and transfer power really effectively between your hip and knee. Think about sprinting, extending your hip back while bending your knee.
Yeah.
The hamstrings are coordinating a lot of that power transfer.
So they act across both joints simultaneously.
Exactly. And what's cool is because they bridge both, they can generate significant force without actually having to contract super fast. It's a quite clever biomechanics.
Makes sense. More power, smoother movement. And it's not just one muscle called the hamstring, right? You said 3.
Precisely. There are 3 distinct muscles making up that group. You've got the biceps femoris, the semitendinosus, and the semimembranosus. They all work together, but have slightly different roles in bending the knee and extending the hip.
Okay, biceps femoris, semitendinosus, semimembranosus. Got it.
So we know where they are, what they are. But what if that tight feeling isn't actually the hamstrings? Is that possible?
Oh, definitely. And that's a really key point G&B Fitness brings up. Sometimes that sensation of tightness you feel in the back of your legs might be coming from somewhere else entirely.
Like referred pain?
Exactly, or just restricted movement elsewhere impacting the hamstrings.
Oh.
For instance, really tight calf muscles can limit your ankle movement, which indirectly puts more tension up the chain, feeling like hamstring tightness.
Or tight hip flexors on the front can tilt your pelvis forward, effectively lengthening the hamstrings constantly, making them feel tight, even if they're not actually short. Restrictions in your lower back joints, your pelvis, even sciatic nerve sensitivity, all these can mimic hamstring tightness.
So the hamstrings might just be reacting to something else going on.
Precisely. They're often just one part of a bigger mobility picture. It's worth thinking about that whole posterior chain.
That makes a lot of sense.
Yeah.
Okay, so assuming the hamstrings are a primary issue, why put in the effort to stretch them? What are the actual payoffs?
Well, the benefits are pretty significant and go beyond just feeling less stiff. Both Medical News Today and Very Well Health mention the link to lower back pain prevention.
How does that work?
Think about it. If your hamstrings are really tight, they pull down on the back of your pelvis, your sitting bones. This can tilt your pelvis backwards, flattening the natural curve in your lower back.
Right, that posterior pelvic tilt.
Exactly. And that altered alignment puts extra strain on the discs and ligaments in your lower back, which can definitely lead to pain over time.
Okay, lower back pain relief. That's a big one for a lot of people. What else?
Well, flexible hamstrings are less prone to strains and tears, especially during sports or sudden movements. If the muscle can move through its full range easily, it's less likely to get pushed beyond its limit.
Makes sense. Injury prevention.
Yeah. Plus, better hamstring flexibility means better overall hip range of motion, which makes everyday things easier, bending down, climbing stairs, you name it. And like we just touched on, it helps your posture by preventing that backward pelvic tilt. It's all interconnected.
It really is. Okay, so the why is pretty compelling.
Yeah.
Now, let's talk how. There are so many hamstring stretches out there. If someone's just starting, where should they even begin? It can feel overwhelming.
Totally. But the good news is you don't need anything super fancy. That Reddit thread we looked at, it had some great simple advice for beginners.
Hmm.
Two main things stood out. First, pay attention to your pelvic tilt. Try to think about gently tipping your tailbone away from the backs of your knees. It's a subtle movement, but it helps lengthen the hamstrings right from the hip attachment.
Sort of sticking your butt out slightly, but hinging at the hips.
Kind of, yeah, but controlled. The second big thing is don't force it. You're looking for a mild to moderate stretch sensation, definitely not pain. And crucially, don't be afraid to bend your knees, especially at first.
Bending the knees seems counterintuitive if you're trying to stretch the back of the leg.
It does, but GMB Fitness explains this well. Bending the knees slightly takes the stretch off the calf muscle and the attachment point behind the knee, letting you focus more on that hip hinge and the upper part of the hamstring, often where the real restriction is. It allows for better spinal position, too.
Ah, okay. So focus on form and sensation, not just reaching your toes immediately. That's good advice. So what are some specific stretches people can try? Maybe broken down by position.
Sure. Let's start lying down. That's often easiest. The classic lying hamstring stretch. Lie on your back, keep one leg bent with the foot flat on the floor, and lift the other leg up. You can hold behind the thigh or calf.
And gently straighten the knee.
Exactly, just until you feel that stretch. Or lube a towel or strap around the ball of your foot and gently pull the leg towards you. Both medical news today and very well health show versions of this.
Very well mentioned. This is good for beginners or people with back pain.
Yes, because your back is supported by the floor, it takes some pressure off. Another lying option is putting your heel up against a wall or door frame, leg mostly straight, and just easing into the stretch that way.
Simple, supported.
Okay.
What about seated stretches?
You can sit on the floor, extend one leg straight, and bend the other knee so the sole of that foot rests against your inner thigh like a half butterfly. Then, hinge forward from your hips over the straight leg.
Keeping the back relatively straight, I assume.
Ideally, yes. Hinging at the hips is key, not just rounding your spine. Very well. Health also shows a seated single leg stretch where both legs are out and you reach for one foot. And if the floor is tricky, use a chair. Sit on the edge, extend one leg straight with just the heel on the floor, toes up, then lean forward from the hips.
Good options for different situations. And standing.
A simple one is to put one foot slightly ahead of the other. Keep that front leg straight-ish, not locked heel down, toes pointing up. Then hinge forward at your hips, feeling the stretch in the back of that front leg.
Like you're about to take a bow, almost.
Sort of, yeah. You can also prop your foot up on a low step, a table, or a chair for a deeper stretch. And then there's the classic standing two touch, but remember the cues. Lift the sitting bones, hinge at the hips, maybe bend the knees slightly. Don't just round your back to reach the floor.
Right, quality over quantity of movement. We've mentioned quite a few static holds. Are there other approaches?
Definitely. Medical news today brings up foam rolling the hamstrings. That's more about tissue quality and reducing tension, sort of self-massage.
Myofascial release.
Exactly. And GMB Fitness really emphasizes dynamic hamstring stretches. Think controlled leg swings, forward and back, side to side, or things like inchworms. These move the hamstrings through their range of motion actively.
The idea being that dynamic movement helps build more usable, lasting flexibility.
That's the theory, yeah. Engaging the muscles actively within that range.
Okay, so we have static, dynamic, foam rolling. How do we make our stretching routine truly effective? Are certain types of stretching better for actually increasing flexibility long term?
Well, based on the sources like Peterson Physical Therapy, for purely increasing range of motion, static stretching, holding the stretch, and PNF stretching seem to come out on top compared to, say, ballistic stretching, which is that bouncy kind, or even just dynamic stretching alone if the only goal is more range.
Okay, PNF. That sounds technical. Proprioceptive neuromuscular facilitation. What exactly is it?
It sounds complicated, but the concept is pretty neat. You're basically using your body's own reflexes to trick the muscle into relaxing more, allowing a deeper stretch. Healthline breaks down a few ways to do it.
Like how?
Okay, one common one is hold relax. You stretch your hamstring to its comfortable limit. Then you try to contract that hamstring against resistance, like pushing your heel into your hand or the floor for about 5-6 seconds, but without actually moving your leg. It's an isometric contraction.
So you tense the muscle you're stretching.
Right. Then you consciously relax the hamstring, breathe out, and gently ease further into the stretch. You'll often find you can go a bit deeper after that contraction relaxation cycle.
Interesting. So the contraction signals the muscle to relax more afterwards.
That's the idea, tapping into neurological reflexes. There are variations like contract relax, where you do move slightly against resistance, and hold relax contract, which adds contracting the opposite muscle, your quad, to pull you deeper into the stretch.
Wow, okay. That's definitely a more active approach. So for the standard static stretches, how long should we hold them and how often do we need to do this?
The general consensus from Peterson, very well, GMB is around 15 to 30 seconds per hold for static stretches, maybe 2 to 4 reps per leg. But the key, always, is no pain, just mild to moderate tension.
And consistency.
Absolutely crucial. Peterson suggests aiming for 5 to 6 times a week to really see progress. Medical News Today even floats daily stretching as beneficial for maintaining flexibility. It needs to be regular.
Makes sense. And what about when to stretch? Before exercise? After? Does it matter?
The general advice is that stretching feels best and might be safest after a warm-up. Warming up gets blood flowing, makes tissues more pliable. Stretching cold muscles isn't usually recommended.
Okay, warm up first.
Stretching after your workout is also good for relieving tension that might have built up. Now, stretching before exercise, especially static stretching, that's debated.
What is that?
Some research suggests that prolonged static stretching right before power or strength activities might temporarily decrease muscle force production. So maybe not ideal before lifting heavy or sprinting, unless your sport demands extreme flexibility from the get-go, like dance or martial arts.
Right. And that's where something like active isolated stretching might come in. Stretch 22 talked about that.
Exactly. AIS is quite different. You actively use the opposing muscle group to initiate the stretch. So for hamstrings, you'd contract your quads to pull your leg up.
And the hold is really short.
Yeah, like only 2 seconds. Then you relax and repeat maybe 10 times, exhaling with each stretch. The theory is it increases circulation and flexibility without triggering that protective muscle weakening response that long static holds might, making it potentially better for pre-activity.
Interesting.
Yeah.
A very different rhythm. Okay, so stretching is important, but we also touched on injury prevention. What else should we be thinking about besides just flexibility?
Right. The systematic review really drove this home. Flexibility is only one factor in hamstring injuries. Other major risk factors include weakness, especially eccentric weakness.
Eccentric strength is controlling the muscle as it lengthens.
Exactly, like controlling the lowering phase of a movement. Also, an imbalance between hamstring strength and quadriceps strength. The HQ ratio is a big one. And differences in strength or flexibility between your left and right legs, known as limb asymmetry.
So just being flexible isn't enough if the muscles are weak or imbalanced.
Precisely. And the review found really strong evidence for eccentric exercises. The Nordic hamstring curl is the classic example in reducing hamstring injuries.
How do those help?
They directly strengthen the hamstring during that lengthening phase, which is often when injuries occur during running or landing. They also seem to increase the actual length of the muscle fibers and improve that crucial HQ strength ratio.
So strength training, specifically eccentric, is key for prevention.
Very key. The review also noted that while static stretching increases range of motion, dynamic stretching and PNF might have longer-lasting effects on flexibility without compromising strength, which is interesting.
Good point.
And it briefly mentioned other things like plyometrics, whole body vibration, even blood flow restriction training as potential ways to address risk factors. But the big takeaway against just stretching is that prolonged static holds right before intense activity. Probably not the best idea.
Right, echoing what GMB and Stretch 22 also said. Okay, we've got stretches, strength work, timing. Let's talk practicalities. If someone starts doing this consistently, how long until they actually notice a difference? And when should they maybe worry or seek help?
Peterson Physical Therapy gives a reasonable estimate. You might start feeling some improvement within, say, 2 to 3 weeks of consistent stretching.
Okay, that's encouraging.
But significant changes in flexibility often take longer, potentially several months. It really depends on how tight you were to begin with, how consistent you are, your genetics, activity levels, lots of factors. Medical News Today also adds that the reason for your tightness matters too.
And when does persistent tightness become a red flag?
Well, Medical News Today advises seeing a healthcare professional if the tightness just isn't getting better despite regular stretching, or especially if it comes with pain, numbness, or tingling.
Why is that?
Because it could signal something else is going on. Maybe the muscle is actually chronically over-lengthened and weak, and stretching it more is counterproductive. It might need strengthening instead. Or it could be nerve-related, like sciatic nerve irritation masquerading as hamstring tightness.
So stretching isn't always the answer.
Not always. And if you've been diligent for weeks or months and still feel chronically tight, maybe look into massage or physical therapy. A PT can do a proper assessment, figure out the root cause, and give you a targeted plan which might include specific stretches, but also strengthening or manual therapy.
Good advice. Okay, this has been incredibly comprehensive. Let's try and boil down the key takeaways for everyone listening.
That's good. So first, understand your hamstrings, those three muscles at the back of your thigh, crossing both hip and knee, super important for movement. Second, stretching them really does offer benefits. Lower back health, injury prevention, better mobility.
And there are lots of ways to stretch static holds. Lying, sitting, standing are great starting points. Remember, form over depth, listen to your body, gentle pelvic tilt, bent knees are okay.
Exactly. Then you've got dynamic stretching for movement prep, PNF for maybe deeper gains using reflexes, and AIs as another pre-activity option. Consistency is absolutely king aim for most days. Hold static stretches for maybe 15, 30 seconds.
But remember, flexibility is only part of the story for injury prevention. Eccentric strength, like from Nordic curls, is crucial. Address strength imbalances.
Right. Don't just stretch. Build strength through the entire range of motion, and maybe avoid long static holds right before playing sport.
And be patient. It takes time, weeks to feel a bit better, months for bigger changes.
And if things aren't improving, or you have pain or weird sensations, definitely get it checked out by a pro.
Perfect summary. So as you digest all that, here's a final thought to chew on. We talked about the hamstrings being part of a chain. Considering how interconnected everything on the back of your body is from your feet right up to your neck, what other areas along that posterior chain might be holding you back? Maybe improving mobility somewhere else, like your ankles or your upper back, could unlock even more freedom in your hamstrings and improve how you move overall. Something to explore.